Hello, it's Rebecca Bowers, DO, and I thought it would be useful to have some videos on some foundational concepts because the framework in which we are thinking about the body and community and whatever it is that we're working with that's in our sphere and scope of practice, that framework is really important, how we organize everything else that we're learning. And ideally, that framework would be not set in stone, but there would be a malleableness to it, a neuroplasticity, that as we encounter different things and we're trying to fit it together, that we allow for the possibilities that we might be wrong. Leonard Bernstein was quoting, I don't know who, but in his series on the harmonic scales, I recall that he started out saying, I reserve the right to be wrong, which is actually a very important thing when you are discussing ideas, because if you censor yourself to the point of only ever saying what's right or known, you miss out on a lot of brainstorming and generating of ideas so that we can expand our knowledge base and discover new things. All right, so setting that concept of conceptualness aside, what I really want to talk about in this video is the body. So when we learn anatomy, maybe somewhere out there someone is doing it differently, but the vast majority of people teaching anatomy and the way the courses go is there's an arbitrary dividing up and labeling of different parts of the body. We do that, one, because it helps us memorize little bits. We memorize these little bits because it helps us communicate with other people to know what we're talking about with something in the body. And also there's tests, and they like to have little concrete bits. They like to be able to specifically word a question about something. So we learn things in this piecemeal fashion, but the body doesn't actually exist as a bunch of pieces that are put together or sewn together. It is one continuous thing, right? We have an ovum, we have a sperm, they join together into this cell, and this cell goes, whee, I'm going to become, in our cases, a human being. And that goes from 1 cell to 2 cells to 4 cells to 8 cells, and it just keeps multiplying. And within those cells, there's fluid and there's proteins and there's ions, minerals, all sorts of stuff. It's all one thing. We come up with different names for different stages of the developing human in these different parts. And then when they get big enough, we start naming different things that look a little bit different. So those are important concepts, but when you put your hands on somebody and you're trying to feel what is going on with the person, the body, one, it's not a thing, it's a process. But two, that process is happening in what many would label a thing, a body. It's happening in a body of one. So I'd like to encourage you to play around mentally with the concept, and then physically see how it translates to you and your patients, or you and your clients doing body work, with this concept that it is one. Now, I just have Leonard here, who's skeleton, but it is not that we have bones and we have muscles and then they stitched in with tendons and things like that. In this one drop of fluid, a really big drop of fluid with lots of compartments, there is just basically varying densities And depending on the density and depending on the composition in an area or how it's lined up, we will give it different names. But when you put your hands on, when you feel in, you can conceptually, your mind might give you different information. It might give you better information if you're putting into your mental framework this idea that it's a whole. It's one blob with varying densities in it. Sure, fascial planes and other things, those can be very important ways of looking at the body and tracing stuff, and definitely knowing embryology and how we grew in line and around and over and through, that can be important. Sometimes the tensions go through that. But to help us hone in on where the problem is, and or where or how much or all, or getting what needs to be involved to help the health correct things, you really want to get a good sense of the whole. So let's just think about a muscle, which I don't have here on Leonard. But with a muscle, we have fascia, we have blood vessels, we have nerves, and we have within that contractile units that have been set in certain patterns, and that's that contracting part of the muscle. So there's multiple different kinds of cells and molecules in here, and we call it muscle based on how it's arranged. And at some point we go, okay, it's having less contractile units, and we are a lot of collagen and other connective kind of cells here, and we're going to call this a tendon now because it doesn't have those contractile units anymore. And then at some point, that tendon, where it meets up with bone, it's not like tendon and bone. There is a becoming less of the cells that make us say that's tendon, and becoming more of the cells that are like bone. So more ossified things. Similar thing when you get to the edge of the bone, the nuanced, where this tendon is inserting, it's really more like an interdigitation. There's this zone where it is tendon and it is bone, because it really is. And the tendon, it is muscle. So all of these things, you can trace lines like that, but even they're all within one fluid. And so I just think that sometimes it's really important to get that foundational concept in there along with all of the other hip bones connected to the knee bone kind of a thing. And it can really expand your palpatory and your treatment skills if you're approaching your patients, clients, from this perspective of one whole with various blending kind of parts.